to us, this is consistent with our mission of promoting health, promoting physical activity. And we're so glad to have you here, Dr. Rodriguez. I know you're in crutches, but even then you're going to be dancing for us. So thank you, Arizona Pain, for your sponsorship and support.
So thank you very much to Adriana and the National Association of Hispanic Nurses, Arizona Pain Specialist, and also Latina Strong. You'll get to learn a little bit more about that. Thank you so much for having me. It's honored to be here to speak with you and share a lot of information and hopefully get the blood moving, because I know you all had those muffins and little scones before, so we got to get the calories going so you can be ready for tonight's festivities. I come and talk to you about preventive medicine today, and I guess my goal for the presentation is to inspire you all to lead healthy lives, to bring the lifestyle back to your families, and to know that as women, you are the backbone of your families. What you bring home, how you live your life, with what you cook, with how you exercise or how physically active, you are the inspiration to your families. And this is very important to go forth because you have the ability to make everybody healthy in your family so that we can be leaders for today, tomorrow, and in the future. So what makes you you? What do you value in your life? It's not the Michael Kors bag or the Gucci shoes or your new jewelry. It's you, your family, your career, and your physical health. So I take it in 3 different areas. Mind, we want you to be of healthy mind, clear, being able to organize, go through your daily activities, tasking, be sharp at work, not have any issues with mood like depression or anxiety that's uncontrolled. We think about the second section, your mind, your body. Making sure it's healthy, making sure there's no injury, illness going on, because without a healthy body, you're not able to achieve all the things you want to. We wear many hats as women, as wives, nurses, doctors, career people, mothers, daughters, all kinds of things. And so in order to be able to fulfill all those roles, we need to have a healthy body and mind. And the last part is spirit. Whatever the spirituality that you have, we want to make sure that you keep that up too. How you feel about yourself and your body and what you can do for your family is very important. So just to kind of give you an idea of, why are we starting this talk, why are we starting to really promote to Latino women, to all women, that we need to have a healthy lifestyle. We are the fastest growing ethnic population in the country. So it's imperative that we really address the challenges in order to continue to be the leaders. It's well documented that communities of color, including Latinos, face significant disparities, especially in healthcare, education, and economic factors. So it's crucial that we put forth policies, we provide resources for people to keep healthy and to continue on with their careers and with their families. According to the Center of Disease Control in 2012, their statistics, the Latino population is more than 53 million in the United States. Nationally, the Mexican Americans are the largest Latino subgroup. Expected age of life for Hispanic males are 78 years old approximately, and the females 83. So we're gonna be living for a long time. So we gotta get it together so that we can keep healthy and keep forth doing all the things that we love to do. Percentage of health insurance right now in Latinos, 69.6%. And how many of you go each year for either your annual women's exam or just a general physical? Can we see a show of hands? Excellent, pretty good. So that's good. Unfortunately, there's not any statistics on how many women or people go and utilize this opportunity for the general physicals each year. Just kind of looking at a few areas: diabetes, heart disease, cancer, and Alzheimer's. A few different statistics regarding our population. 2011, Hispanics are twice as likely to be diagnosed with diabetes. Higher rates of end-stage renal disease caused by diabetes. There's 50% more likely of the Latino population to die from complications of diabetes than non-Hispanic individuals. And as of right now, 29 million people of the Latino population have diabetes in the whole entire United States, and that makes up 9.3% of the population. We can't live with unhealthy diet and exercise if we want to continue being the leaders. Cardiovascular disease. Surprisingly, hypertension, high blood pressure is not a huge issue. We're not the leading people in that, so that's excellent. But we suffer greater percentage of our population suffers from obesity and being overweight. And so that's what I hope to bring today, is to show you even 10 minutes a day doing some small exercises, that we have that instilled in our program so that we can keep leading healthy lives. Risk factors for cardiovascular disease, as we all know: family history, high blood pressure, high cholesterol, diabetes, tobacco abuse, and also obesity. Cancers, you may ask, what's the leading cancer in Latino population? It's still breast cancer, like any other population. Secondly, there's the colorectal cancer and also thyroid. Alzheimer's disease. We don't really think about this too much unless we have a family member that has had it. But looking at the statistics, I was really surprised to see we are 1.5 times more likely to get Alzheimer's disease than Caucasians. And that's really going to be due to increased cardiovascular risk factors. So again, we want our minds to be healthy, our bodies to be healthy, so that we can go ahead and continue living healthy lives. I bring to you preventive medicine, and the definition is as such: specialty of medical practice that focuses on the health of individuals, communities, and defined populations. Its goal is to protect, promote, maintain health and well-being, and to prevent disease, disability, and death. That's what our nation needs in order to continue to lead. Leadership starts with all of you, each and every one of you, because you are the backbone of your family. So whether you have an HMO, a PPO, an EPO plan, Medicare, you're doing the Affordable Care Act, all those insurances pay for your general physicals. So make it a family thing. Go out with your families. Have yourself, your husband, your kids go on a general physical day to the doctor, and make sure you get all the tips and the resources you need to keep your families healthy. All of these insurances pay for 100% of the general physical and your well women exam every year. So we work hard for our money to provide for our families, utilize the insurance, because these are the benefits that we have for general physicals. And there's not even a copay to the office, so use that for your Starbucks that day. So that's excellent. What do we do at the general physical? You may know the doctor will go ahead and check you out head to toe. We'll look at your eyes, ears, nose, and throat, look at your thyroid gland, listen to your heart and lungs, an abdomen exam. We might go forth and do your breast exam at the time of your women's exam, along with the pap smear. Going through and talking to you about your risk factors for any of the disease states we talked about. Looking forth to, talking about your diet, your exercise habit, seeing if we can give you resources to try and make that happen in every day of your life. Medication management, looking at what medications you have right now and discussing any side effects. So the doctors actually really like doing the general physicals, because this is our time to educate and to really help and make a difference in somebody's life. And we get to know you better, so that's a lot of fun. So we all know this pose, because we do it once a year, maybe now once every 3 years with the new guidelines. But incorporating that once a year, getting the pap smear done. New guidelines per the American College of Obstetrics and Gynecology have stated as long as you have low risk factors for cervical cancer, you can start doing your women's exam every 3 years, and they stop at 65. So if your doctor's still doing your pap smear after 65 years old, you got to talk to them because it's time to stop that. Of course, the bimanual exam is performed. Breast exam, we talk about your mammograms, and also get you set for colonoscopy, which can be once every 5, 7, or 10 years. So just to give you a couple examples, what things to look at. I know we've always tried, all kinds of things. We're looking at the Latina app, getting, here's how I'm going to burn fat. I'm going to do this type of, supplement. I'm going to talk to my sister because she's cutting out all the carbs, all these things. But really looking at, what standardized programs help to make a difference and investing in yourself to have a healthy diet. Of course, Weight Watchers is always excellent. MetaFast, I'm not sponsored by any of those. I'm just saying, I know my family and different people who have done it, and it makes a big difference. Paleo diet, the caveman diet, so all you guys out there can do that on lean meats, fish, fruits, nuts, veggies, and also some dairy as well. But you eat the good carbs, the good complex carbohydrates instead of the bad ones that we find with flour and sugar. All these different programs can help you to, again, prevent disease, lower your risk factor for diabetes, heart disease, hormones, whatever age you're at. If you're still getting your menstrual cycle, if things are kind of crazy, they're too heavy, they're abnormal, or maybe you're going into menopause, you stabilize your diet, you start doing the exercise, you can stabilize your hormones. So they're not too crazy because we know what that does to all the women, and they're not fun. Set a good example for your family. This is, why we get the diet and exercise going. And of course, prevent childhood obesity. So you ask, well, what kind of things can I do? How can I get started? I don't really do anything, or maybe I'm tired. I don't have time at the end of the day. I know how 12-hour shifts are for the nurses, and it's hard, especially with the different time zones, and also with if you work an overnight shift or the day shift, it's very difficult. But start about 20 to 30 minutes 3 times a week with cardio. That can be anything from walking to running to elliptical, hiking, riding a bike. All those things will be great. Light weights or resistance training is always important to incorporate to keep good muscle tone. And then you can start working things up. And then per the American Heart Association, they suggest that you do 60 minutes a day, 6 times a week of cardio. So that's the goal that they hope to get across to everybody. The other thing that's kind of big right now is what kind of things can you do in a short exercise to really burn calories, to really get your bang for your buck. And that's going to be something called high-intensity interval training. And we're going to do just a little bit of it today. So in a little bit, I'm going to have you kick off your stiletto heels and the wedges, and we're going to just do a little something to get you going. Stretching, very important. Making sure you do 7 minutes before and after your exercise. Very important because it keeps your muscles long and lean. It helps to prevent injury. Making it fun. You can do anything to try and keep yourself interested in it with yourself or your family. You can use tools such as the Fitbit. It's the bracelets that end up lighting up, counts your steps. You can enter in the app with your calories, your food, your water intake. And it's fun because you can kind of get your own community of friends, encourage each other to get your steps going, or you can cheer them on. So I think it's a very good community type of exercise. Our office over in San Diego, we actually have all our nurses and our staff that have the Fitbit, whether it's the bracelet or if it's the little like little pager or something, you know, a little clip-on on your hip. You can use those, and everybody's friends in there encourages everybody to get their steps in, do the workout. Everybody's doing a boot camp class in our office now, twice a week for half an hour to really get the blood flowing, and that helps everybody to perform better and feel good about themselves. There's different applications on your phone that you can look at. Lose It, MyFitnessPal, and if you don't want to do any of that, record it in a book. That keeps you accountable. These things help you to keep accountable for yourself, and you're investing in your health. Energy, long day. At the end of the day, nobody wants to do an exercise. Maybe we want to sleep in the morning because we don't want to get up a half hour early to do anything. So a couple things. Talk to your doctor. If the energy level is low, maybe you do vitamin B12. That can be orally, or the doctors usually offer an injection one time a month. Very healthy, is natural vitamin B12, does give you that boost of energy, lasts for a month. Making sure you get adequate water intake and also sleep per night. So make sure your doctor is taking care of your complete health. Be conscious of your diet, your exercise, water intake, and really make the commitment to become healthy and fit. This is my family, with my sister, mom, my godchild, and my sister-in-law. And talking with my best friend, Petra Fimbres, we actually started to come up with a foundation called Latina Strong. And we're very excited to bring that to you today. It's in promotion of good, healthy diet and exercise in order to prevent disease and help our Latina women continue to inspire their families and become and stay the leaders of tomorrow. Our mission states to educate Latinas in health and wellness through diet and exercise to promote optimal health in your body, mind, and spirit. Latina Strong inspires women to be at their best, perform to their highest level, be the role models for our culture in health and fitness, decreasing risk factors for disease, promoting a new healthy lifestyle for our family. So let's get to work. We'll go ahead and have you guys again take off your shoes. We're gonna have you stand up, and DJ, let's hit it. Okay, so we're gonna start just walking in place. If you wanna follow Lucy, this is Bethany, this is Bailey, our scholar athletes. So we'll get walking from Arizona State University. Woo! Go Devils. And let's pick up the pace. 1, 2. Let's take it to the right. Keep going to the right. Got lots of room. And left. Good, just getting the blood flowing. Let's get some stretches going. And feet apart. And we're just gonna lightly go forward. Please use your chairs to kind of balance all the way forward, stretching those hamstrings. Always holding for 20 to 30 seconds in your pose. And right leg, going over to the right leg. And to the left leg. Gotta get both sides, even it out. Good, and we'll do a nice back stretch, standing up nice and tall. Hands on the hips, arching back. Good. Stretching to the right. And turning to the left. And reaching down the right side of the leg. Other side. Excellent. Let's go ahead and use our chairs You can put it right in front of you. And basically, we're gonna do some double leg squats. So holding on to the front. If you watch Lucy, both legs planted, hip width apart. And just like the Brazilian butt workout, stick that boom boom out. Give me 10, 9, 8, 7. Keep sticking that booty out. 4, 3, 2, and 1. Single leg squats. We're putting your right leg up. Make sure your knee does not go in front of your foot. It should be in alignment with your toe, your big toe. And single leg squats don't need to go all the way low, just 10 to 15 degrees to isolate that quad muscle. Down and up, down and up. And 8, 7, feeling the burn? Mm-hmm. 4, 3, 2, and 1. Let's switch legs. And again, 10, 9. Make sure you're watching your knee, doesn't go over those toes. 6, 5, 4, 3, 2, and 1. We're gonna do some simple leg lifts using the right leg. Again, holding on to the chair and hips nice and square to your chair. Lifting the leg up just a few degrees and up. 1, 2. Get that booty workout. 4. And 8. 9, and 10. Sideways. We gotta get the side. My trainer calls it side junk. 4, 5, 7, and last one, 10. You feel that on your left side? Go ahead and give me a little stretch, just sinking the hip to the side. That will stretch that out. You feel that? Good. We'll switch to the other side, standing on your right, left leg back. Again, leg lift straight back. Hips square. 1, 2. Let's pick up the pace. 3, 4, 5, 6, 7, 8, 9, and 10. Taking it out to the side with the left leg. 1, 2. You feeling it? Doing this just for 10 minutes a day. That's all you gotta do. Burning those calories, getting it going, gaining that muscle tone. Looking good. Good. Now let's go to the other side, just sinking the hip, trying to get that stretch on that side. And now we're just gonna go ahead and do some toe raises. So there, standing on both legs, we're gonna go up and down on the toes. 1, 2, 3, give me 10 of them. 4, 5, 6, and last one. We're gonna actually move to the chair, inside, and couple last things. You're gonna hold on the side of the chair. We gotta get the abs, most important. So holding on there, you're gonna actually just do some simple leg crunches. So moving out and in, out and in. Give me 10. If I can do it in a boot, you can do it too, because this thing is heavy. Excellent. Now we're gonna do some bicycles just so that we can get those obliques. We'll finish up with a nice stretch and we're done. Here we go. bicycles, go towards the knee. So you're twisting, twisting, twisting. That's for your obliques, side abdominal muscles. You feel that? Good. Let's go ahead and stand up. Last part, just trying to do a little quad stretch. So we're gonna push your leg back, trying to stand, because we did work out those quads. And that leg back, doing a calf stretch, all the way down. And other side, standing on your right leg, left leg up, behind. And left leg back. Good, and let's just take it forward. Big breath in, both hands up. 2 more. Excellent. Thank you for your participation. Hopefully you got a little sweat. Take it back every day to you and your families. And Latina Strong, you'll see us in the t-shirts. And we have a special surprise that hopefully by the end of the day, you'll all have some bags saying Latina Strong. Thank you to Arizona Pain Specialists.
Thank you, Arizona Pain. Thank you so much for getting us started on that healthy note.